Apheresis is a medical procedure that involves removing whole blood and separating the blood into individual components so that one particular component can be removed. The remaining blood components then are reintroduced back into the bloodstream. Whole blood is drawn out of one arm and into an instrument called a separator, which uses a microprocessing technique to draw the blood, anticoagulate it, and separate the component to be removed by centrifugal spinning, filtration, or column adsorption with the help of computerized calibration. Apheresis vs dialysis. Apheresis is the removal of blood from a patient, and the removal of certain components, such as platelets, from that blood, followed by the transfusion of the filtered blood back to the patient. Dialysis is a method of separating molecules or particles of different sizes by differential diffusion through a semi-permeable membrane. Therapeutic apheresis, for white blood cells. For red blood cells. For platelets. For plasmapheresis. With extracorporeal immunoadsorption, selective absorption, or selective filtration and plasma rain fusion. The cells to be removed are collected while the remainder of the blood is recombined and returned to the patient through a tube and needle in the other arm. Plasmapheresis is the isolation of the plasma from the blood. Plasma exchange isolates, discards, and replaces the plasma with a substitute fluid, like albumin. Report 36516 for extracorporeal selective adsorption or selective filtration, such as dextrin sulfate cellulose columns to selectively remove low-density lipoproteins, with plasma rain fusion. Photopheresis, extracorporeal. The physician draws a patient's blood and exposes the blood to light to eliminate destructive elements. The physician establishes venous access or attaches the machine to an existing central venous catheter line. The blood is removed and cycled through the pheresis machine where it is exposed to therapeutic wavelengths of light. The conditioned blood is returned to the patient through a catheter and a needle inserted in the vein. Obliteration. Obliteration means to remove completely, a body organ or part, as by surgery, disease, or radiation. Obliteration of aortopulmonary septal defect, without cardiopulmonary bypass. With cardiopulmonary bypass, the physician gains access to the mediastinum through an incision through the sternum, median sternotomy. The physician places cardiopulmonary bypass catheters through incisions in the low inferior vena cava, the superior vena cava, and high aorta or femoral artery. The physician stops the heart by infusing cardioplegia solution into the coronary circulation. The physician cross-clamps the aorta, places sump suction in the left atrium to obtain a bloodless surgical field. The physician exposes the aortopulmonary septal defect by cutting through the ascending aorta or main pulmonary artery. The physician closes the defect with a Dacron fabric patch, closes the aortic or pulmonary arterial incision, takes the patient off cardiopulmonary bypass, closes the remaining surgical incisions and dresses the sternal wound. Mastoid obliteration. Through a post-auricular incision, the physician accesses the mastoid cavity of a previous mastoidectomy. Any remaining mastoid disease is removed. To lessen the size of a large mastoid cavity or to stop a cerebrospinal leak, the cavity is obliterated with a rotation flap of fascia or muscle and/or free fat graft and skin. The flap is sutured into place, and the incision is sutured.